Sorry, can you hear me?
Yep.
Oh, there we go. Sorry, I'm literally running from the commissioner's office. I'm like, I gotta go.
Is my audio on, Corey?
Yep, I can hear you. Thank you.
Okay.
Sorry, I'm out of breath. I was literally running fast. Welcome, everybody. It's 11:29, so we'll wait just another minute or two. It is summer too, so I don't know if our normal folks will be here. Alan, I just found out this morning that Cheryl was double booked, so she's not available.
Do we have her statistics or not?
I have her information. It's a lot, so I didn't know if you just wanted to wait and have me send it to everyone to review, because it's also some state quarter information.
Okay. Well, that's any highlights or successes you want to share?
Let me open her file and I'll check that.
Okay.
And then Dane is on vacation, but I think Kim Gandy was going to come in his place and do the stats. If she doesn't make it for some reason, I can pull that up.
Okay, sounds good.
Oh, there's Kim. Kim, were you going to present Dane's information?
I would be happy to.
Okay. What we had Dane do last time is that he pulled open the document to share. I think it's a little easier for folks when they can see it. If you don't have that, I have it.
I have it here ready.
Okay.
We'll give it another minute, Corey, and then we'll stop. Okay.
I'm not sure I see the lady from Cow Creek on here yet.
Oh, okay, I don't need.
I'm just checking my emails real quick. I sent her an email just seeing if she was good to go, and I haven't seen anything back yet. But Alicia's on here. She's from Cow Creek.
There's Whitney. I see Whitney down there at the
Okay.
floor right. Okay.
Yep. Perfect.
Okay, I will call this meeting to order. Thank you for everyone for coming. Corey, do you want to have everybody introduce themselves, or can you see everybody that you need to see?
I'll let Whitney introduce herself.
Hey,
Think
Whitney.
everyone else, and maybe Chad. Chad's newer to the group.
Okay.
Oh.
Are you there, Whitney?
Hi, I'm here. Just trying to get the computer working again. I'm Whitney Use. I'm the behavioral health program supervisor here at Cow Creek. And then I have
Darlene Chapman with our Cow Creek Social Services Department. And
Okay.
I run transitional housing through the tribe.
Thank you very much. Appreciate you being here. Chad, you want to introduce yourself?
Yeah, great. Thank you. Good morning, everyone. My name is Chad Campbell. I'm one of the new community engagement liaisons for Boulder Care, and I encompass the bottom half of the state of Oregon.
Hey, thank you, Chad.
Thank you.
Yeah, I think, Corey, everybody else that's here today right now that we already know about, don't we?
Everyone else is our standard ones, which we appreciate seeing every month. So thank you.
Yes, you appreciate everything. Okay, first order of business is, approval of the minutes from June 24th. So we'll have a motion to approve the minutes from June 24th.
I'll make that motion to approve the June minutes.
Thank you, Janelle. Do I have a second?
Second.
Thank you. Motion made and seconded to approve the minutes from June 24th. All in favor? Say aye or raise your hand.
Aye.
Anybody opposed? Motion passes. Thank you very much. Okay, so Corey indicated that Dane is on vacation, but Kim Candy is going to give us the update from the connecting point.
Yes, I'm gonna pull it up here. Corey, I think you need to allow me to share.
Should be good now.
Okay, there it is. Okay, so yes, as was mentioned, Dane is on vacation this week, so he asked me to step in and just present to you guys these numbers. I don't think I need to go through this whole list, of course, because I know that Corey will probably send these out with the minutes too. But it looks like we had about 58 unduplicated clients for the month of June. We did add services over in Reedsport. The word I hear is that that is going really well. It's well received by the community, and I think it is being utilized really well. So these numbers are actually down a little bit from last month, probably for a couple different reasons. I know that there was some hot weather that might have affected people going out for services. And then it's my understanding that people have been moving around a little bit. And so maybe it would be a little bit difficult for them to get to the services. For example, I think the OTP, that's usually the busiest connecting point site. I think that was down a little bit just because there weren't as many people camping in the area. So just to scroll down here, 128 showers. Wound care, hygiene, lots of naloxone going out. That is the mostly the nasal naloxone. And then we HIV Alliance did stop the syringe exchange services. So that's why those show 0. And that was per the city of Roseburg. So do you all have any questions on any of that data?
Oh, my guess is, like you mentioned, that probably some of that numbers are down because of the hot weather. And also, you said you thought there was a lot of moving around, people maybe not being able to get to the service.
Yeah, like I said, I think, especially down in the OTP area, down in the Point area, I think that has really kind of dropped in numbers. And please, if somebody else has better information than that, please jump in. If Joaquina or even Corey, if you have more, but that's kind of what the word I heard was kind of happening a little bit.
I heard Dane say that as well.
Yeah.
Go ahead.
We think the point is down about 50% from what it was before. And Officer Chavez has told me that the decrease in needles is quite substantial. It's definitely noticeable now. The needles that they're seeing, the used needles that are laying around.
That's amazing to hear that that this is working. So that's good news. And then yeah, that makes sense. Like you said, if attendance down there is a little lower than usual, that makes sense in the numbers.
Hey, thank you, Kim. Any other questions for Kim?
So it's not a question, but just to add, one of my drug court participants who's trying to graduate on August 26th, she did a wound care kit community project, and she's going to be available at the Connecting Point location on August 7th, which is at the Opioid Treatment Center on that day from 12 to 3 to hand out kits. She's made over 400 of them so far. And what she doesn't hand out during the Connecting Point timeline, then she'll give to the OTP clinic to have on hand so they can continue providing those to people in need.
Very good. Very, very good. Appreciate it. Okay, any other questions for Kim or any other comments? That's a great idea. Behavioral health updates. So Cheryl's not here, right, Corey? Do we have any statistics or do you want to highlight? I know you send out the major portion of that stuff with the minutes, but
I'll send out the major reports that she sent. She also provided the quarter report through the state, so I'll send that out to you guys. She's the normal one that could read those. I'm not going to attempt that. What she did say for impacts, though, for quarter two, they provided 1,052 services during 542 encounters, so that number is definitely increased. There's been 77 jail in-reaches and 152 services provided relating to housing. They are now at 712 cohort members for impacts, so that number keeps climbing. Right now, they're dealing with 189 of those cohort members as the actual most current ones with 4 or more incarcerations. So for those that are a little newer and maybe haven't heard this, you have to have 4 or more incarcerations within a year's time with our Douglas County Jail to be automatically placed into this cohort with the Impacts Grant program that we have with ADAPT. And that allows them then to utilize some of the grant funds for different things that they need. They've helped people over the years with housing, transitional and permanent housing. Some of them needed specialty clothes, such as work boots or things for a new job that they acquired. Some need help with transportation or a phone. And so they do a lot of services for these folks once they get into that cohort. They do some jail in-reaches prior to them getting in the cohort. So Umpqua Health Alliance keeps track. They get all the jail feed information and then the emergency department information. And they provide us information during our impacts meetings to let us know. It's kind of a circle chart. So they have these little bubbles that are on a screen that let us know, okay, here's the folks that are right on the cusp of joining our impacts cohort. This next layer of bubbles are those that, have the tendency to, move closer and closer to becoming part of the cohort. And then the outer bubbles are like, okay, these are folks that have just been arrested once, so we're not as concerned right now, but we need to keep an eye out, maybe do some jail in-reaches as they get in the jail again. So that's just kind of a behind the scenes peek to you guys of what we deal with in our impacts meetings. For the resolution room, she said 18 individuals had a total of 27 stays in the crisis resolution rooms. Individuals are being served for a variety of reasons, including detox placement, inpatient placement, transportation arrangements to counties of origin, appointments, court dates, and engagement in outpatient services. For mobile crisis, they documented 699 unique calls for service. Additional details related to in-person calls versus telephone calls she said will be available soon. So that wasn't available at the time of this report. And then for Sobering Center, there were 65 admissions to the Sobering Center. And let's see. For the program and number of clients from the Sobering Center, the ACT group got 3 of them, Detox got 9, Mental Health Outpatient got 1, the Peer SUD program had 2, Residential Treatment 2, and SUD Outpatient had 2. So for referral source, this is meaning where they're getting the most of their clients coming into the Sobering Center. Law enforcement had 8, Douglas County Sheriff's Office 1, ADAPT Mobile Crisis had 11, ADAPT Detox had 1, and then she has a category that just says other, and that had 1. Actually, she has a line here. I'll have to ask her about this. She has 15 marked on it, but she doesn't have a title of where that one came from. So I'll have to ask her on that one. So total services, they had 30 people being sent to the program. And those that were served there in the program, 12 of them were housed and 18 of them were unhoused. So I will send this report. I will ask her about the one question on the Sobering Center on the 15 because she didn't list that one. But that is what she sent. I think I saw something pop up in the chat. Sorry, I don't keep the chat open always. Wakina. Okay, so Joaquina said her department peers have provided 862 direct services last quarter and 136 so far this quarter. That is nice. Good job, Joaquina.
So what department is that? The Joaquin is,
Adult outpatient for SUD.
oh, okay, thank you. And so mobile crisis is still active 24/7?
Yes. I know they were down one van that was being worked on. I asked her in an email this morning if that was repaired yet, and I haven't heard back.
all the time, those numbers are very, very impressive, and I'm glad we're providing those services. Any other questions that Corey could?
So again, just on a side note with this, I have another drug court participant whose project is the 5K for mental illness awareness. We partnered with NAMI. Trista's on here. She's going to have a table there. And anyone else that wants to be a table partner to provide some information, we'd love to have them there. I know there's also a kids safety fair later that morning. So some folks, we said, if you can just be there a little bit, the first thing when we start around 9 and then pack up and go do the other one, that's fine too. You don't have to be there the whole time. But what we're hoping is that community people can come in, get some information prior to the 5K starting, maybe go put it in your car and then come back and we'll have the ribbon cutting with the mayor at 10 a.m. and then everyone will go off and either run, walk, jog, whatever they prefer. We'll have bubble machines, we'll have water and snacks, t-shirts while they last, bracelets while they last, little pins, ribbon pins to wear. Hopefully try and make it fun. We have noisemakers. Hope we'll have some cheerleaders available to, not true cheerleaders, but people cheering people on when they come back. Leashed pets are welcome as long as they're nice and okay with other dogs.
Hey,
But Adapt will be there.
happy to be here.
That's why I'm bringing it up.
Okay, very good. Any other questions or comments on the DAP report?
I was just gonna ask Corey if you were able to send over the event details. I don't know if you have my contact information. I could circle back to my calendar to see if that's something we can possibly put on our books.
Okay. Yeah, I can send that to you.
Thank
I
you.
think you emailed me a week or so ago with something else. I think I sent you the connecting point flyer.
Oh, you know what? I think you did. I apologize. Yes,
Okay, yeah, I'll make a note to email you.
appreciate it.
And if anyone else wants that, I have a really short form that's for table partners, just so we are aware who's coming. It's very quick. It's fillable PDF. So if anyone's interested, just send me an email and then I'll send that back to you. Like I said, I have Trista's and I have Adapt.
Hey,
Thank you.
thank you, Corey. And no other questions or comments about the Adapt. On to the Mercy Medical Center's April update. Lindsay?
I don't have a whole lot to report. We're operating at 60 to 80% capacity. So we're still open. We don't really have anything significant this time. Unless anyone has any questions.
Just had to mute myself because my landline just rang, so back.
Oh, okay.
I have 3 different lines going, so I have to.
I don't
monitor.
envy that.
Yeah, unfortunately. Yes, so you said 60 to 80% of capacity, so you do have open beds.
Yes, we do.
And are you satisfied with your
Your line must keep ringing.
While he's on his call, Lindsay,
Okay.
I think maybe a few meetings ago, you mentioned you were looking for new brochures from people. Are you still needing information to have
I
there?
would love that. Yes.
What type of brochures specifically are you wanting, like, Jesse's with Painted Horse Recovery? Are you wanting stuff from Chad at Boulder Care? Do you need our resource guides that we have through the county? What kind of things are you?
Various, because our patients have various needs. So some are substance related, some need more NAMI resources. And also needle exchange, safe needle exchange now, that's come up a few times since it's not available.
Just to ensure that I have your best email, Lindsay, would you mind throwing it in the chat and I can certainly circle back this afternoon and send you some information?
Absolutely.
Great, thank you.
Anything else?
So Lindsay, I actually have a quickie question. Where are most of your referrals coming from these days?
All over Oregon, Pendleton, Lebanon, Albany, Corvallis. Not much down south. And then, of course, Roseburg or Douglas County.
And are there particular agencies? Are these all coming from Mercy or where are they coming from?
From outside emergency rooms as well.
Thank you.
Yep, no problem.
And Lindsay, just to update, you still have a time limit on beds, right?
What do you mean by time limit?
Well, individuals, for the amount of time that they are, you can hold them there without special
No,
circumstances.
our goal is 5 to 7 days, but we have people that don't stay that long and some that stay for much longer. We've had, 60-day stays. So.
I wasn't aware that you 60 days. I didn't realize you that some of it's in. Thank you, Lindsay. Any other questions, Lindsay?
I see
Yeah,
Tristan has her hand up.
Yeah, Lindsay, I must have missed. Who are you with and who do you serve?
Oh, I'm at Mercy Medical Center, the inpatient psychiatric unit.
Okay. I have an individual right now, and I'm like, this is just to throw out to the whole group, but this person has basically exhausted all of his resources. He's been kicked out of actually all of the tech camps, the mission, and it's because he can't stay clean off marijuana, a little bit of meth use, and we're trying to get him into some like inpatient, but he just spent about $600 on a 4-night stay for a shower at a hotel. And he's really trying to get things together, and he needs to get a tent. I've been looking for a tent for him so that he can at least find somewhere to be if he's not accepted into the mission or the tent camps. So if anybody has any resources in this group, it would be really, really helpful because we're kind of like boots to the ground right now, driving around trying to figure out what to do. So I will put my email in the chat. And if anybody has any resources to help me with, that would be awesome. Thank you.
Trista, do you know if you checked in with Bernie's camps? I saw your email and someone chimed in on that, and Bernie said to check in with the site manager.
I did all of those things. Bernie responded that something had happened in the past that he had to check in with the site manager, and the site manager shared some information with him that he had done something unacceptable. Bernie doesn't really know what it is or what. I know that the camp lifestyle is a little bit more rough, rough and tough down there. There's no way for him to get back in if he's been kicked out once, kind of a thing. So that's kind of been exhausted at this point. So
could go to one of the different camps. Each camp is kind of autonomous.
We went to 3 camps. We went to 3 different camps.
Oh,
and,
wow.
Sutherland, we went to Sutherland. They had an open bed, but they wouldn't take him because he wasn't a Sutherland resident.
Oh, wow.
And so there wasn't any bending on that. There was one, hold on there, just a minute. I'm in a meeting. Okay. Sorry, I'm working from home. Shut the door, please. Maddie, shut the door. So I went to the other 2 and they're being observed by the same site manager. And so that one site manager was the one that kind of kicked him out of all of the tent sites. So if anybody has resources, even if it's just a tent, I just need a tent at this point is basically what I'm going for.
Do they only reside in Douglas County?
What's that?
Do they only reside in Douglas County?
Yeah.
Yeah. Okay.
I mean, he was open to moving to Sutherland just to get into a tent site in Sutherland. But you know,
I know of some resources down here in Jackson County, but I believe they would have to either be a Jackson County resident or at least have access to some of the locations down here. But
I'd be open to resources.
great. Yeah, I'll send
Thank
you
you
an email.
guys.
Hey. Good information. So thank you. That's what you want to share. Do we have any other roundtable updates for our behavioral health? Moving on to housing updates. Neil, do you have anything you want to share with us?
Yeah, so on the housing authority side of things, it's kind of same old song. Our Section 8 is at a standstill right now. We have our other portfolio of housing throughout the county that has longer wait lists, but it's always worth trying to get on the wait list. On HTAG, our last meeting was kind of light, just sharing resources and talking about housing issues and our messaging. We want to be more effective and deliberate at the Homeless Commission meetings. We want to support our city council members and also share different perspectives through data and stuff as far as things for consideration. So we're kind of working on how to improve upon that. And so that's been the primary thing with HTAG. And I want to do a shout out to Jacob with St. George's I can never say this word, Episcopal Church, that they did open up for a cooling center about 3 or 4 days this last month and when it got really hot. So really appreciate his efforts and the volunteers that all participated with that to provide some place during the day to get a little relief from the heat. So big, huge shout out and thank you for that. And then I'm hoping I can ask a question, possibly Chair Hobson, that I had heard some conversation that within the city of Winston, there was some concern over RV parks and living, being able to quickly vacate in the event of a flood, especially those along the rivers. And so our housing subcommittee was concerned, is there anything we can do to help support? Is this a true conversation happening? Is there something that we should be aware of that could affect individuals' housing? Is there anything you are aware of that you can share on that topic?
We're slated to have a workshop at 5:30 on August 4th, our regular council. I'm going to revisit. We had quite a long, 3-hour long meeting, our last council, discussing this. What we're most concerned about is that 3 of our RV parks are in the floodplain. And so many of them have been there, some of them have been there for years, and their vehicles are no longer capable of moving. So in the event of a flood like we had back in April, that got into the RV park there next to the river and floated some things away that were unsecured. And we were more concerned about people being able to exit within a half an hour or so of an emergency. And there's so many of them that do not have the ability now to actually move their RVs out of the park because they've been there long enough that they've added permanent structures to their RVs, or maybe their tires are rotted off. And there are some cases that is the case. So we're going to have a workshop again with these same people, trying to find a way to mitigate the concerns we have as a city and their concerns about being forced to move when many of them have no ability to subsist outside of their RVs. So a lot of options still on the table, but I think that the bottom line is they do need to be able to move on a moment's notice if that's if the river comes up again, because last thing we want to see is something like it happened in Texas, where there were so many deaths, and then of course RVs floating down the river to that town. So anyway, that's the update right now that we have going on.
And that August 4th workshop is open to the public?
Yes, yes, it is.
And what time was that?
That's at 5:30 at the community center. At Winston Community Center. It's not in the city hall.
Okay,
It's at the community center.
thank you. That was all my updates and questions. Thank you.
Hey, no, thank you. Yeah, is there any other questions for Janelle? Thank you, Janelle. Yes. So we'll move on to oh, excuse me. So no other updates from our roundtable for housing updates? Hey, thank you. Moving on to our presentation from Whitney from the Cow Creek Band of Umpqua Tribe of Indians. And what is your position again, Whitney?
I'm the behavioral health program supervisor.
Hey, thank you. You want to go ahead with your presentation?
So I was just going to share some of the services and resources that we can offer here within the tribe. In behavioral health, what we have is we have therapy, psychiatry, substance use and peer support with those, and then youth prevention. With those programs combined, we also have for tribal members, we're able to offer 10 transitional apartments that can cover them up to a year. It is complete sober living, so a lot of our clients, we get into a hotel or start working within the treatment plan, and then we'll be able to transition them over there and kind of case manage following that. And then we work really closely with social services and their housing as well. But that was pretty much what we have been able to offer and kind of assist a lot of tribal members within getting into either a hotel until we can find stable housing, or into a apartment that within that year we have been pretty successful in getting them into permanent housing afterwards. And
So with our services through the Cow Creek Social Services, we only serve Cow Creek members, but I just wanted to share with you, if you do have a member in the community, they should kind of know their services, but either way, you can refer them back to us. We have 13 transitional housing units in Canyonville. We have a couple of safe houses, and we worked very closely with all our community partners, ADAPT, pretty involved with Connecting Point and so on. So we have a lot of resources in-house, just like UCAN. We have the same funding as UCAN does, but here for tribal members. So I don't know if you knew that, but if you have any questions or, please feel free to reach out.
Do you have multiple clinics, or is it one main clinic where you work with folks?
so we have a clinic down in Canyonville behind the casino, and then a clinic up here by across from Evergreen. And those are for primary care, psychiatry seen at those offices as well. And then we also have our behavioral health, substance use, and all of those are down here at Village Station, but we travel for a lot. We go where we're needed. A lot of our clients come here, so we offer 10 groups. It was 10. I think it might be 9 at this moment, 9 groups a week, between therapy and peer support, culture group, and then recovery throughout the days. And then we can work out of any of the offices though, but we're mainly stationed here at Village Station down by McMenamins.
So on average, I don't know if you can answer that, but how many clients on average do you think you guys see either on a weekly or monthly basis?
For substance use?
That, or also for behavioral health services? And we don't need an exact number, just kind of a ballpark of what you guys think. I was just curious how full you are.
So we do have openings. We all have openings. We have telehealth for therapy and psychiatry also available. So we do have plenty of openings to see clients at this time.
And then you're a location there that's kind of across from Evergreen Urgent Care. Last time, I think someone reported you guys had a pharmacy that was going to go in there. Is that still happening?
Still in the works, but yes.
But the pharmacy was open to anyone, or is that still just tribal members?
That information hasn't been fully released yet.
Okay. These are just tribal members, correct?
My understanding is any patient of the clinic, but last I heard, it hadn't had the final decision made yet.
Okay.
So you mentioned housing. Do you have enough housing available for those that might need at least temporary housing?
Yes, so they are for Native Americans. We're not at full capacity at this moment. That it is a program that they have to join in and then, participate in our services and stuff. So I can't say that we're searching. And a lot of the times we do utilize the hotels. So we do put them in the hotel as soon as possible and try to monitor that to see if they're actually wanting to make these changes before we put them in an apartment. But we do at this time currently have enough apartments to continue maintaining the clients that we have currently.
Okay. Very good.
I don't have a long wait list.
Well, that's good. That's good. And the housing you provide is all over, is it basically in Canyonville or in Roseburg, or?
The ones we have are in Roseburg. They're not far from the office, and we do transportation to get them back and forth to here, DHS, wherever they need to go.
Very good. Any other questions for Whitney or what they're providing? Okay, thank you very much. Good information and definitely good program.
Thank you.
One thing I'd like to mention, and I don't know how many of you get the news review, but there was a very good article about the RSAT program that is going on in Douglas County. And I would very much encourage anybody that has not seen it to find some way to get it. Corey, is there a way that we can send that out as part of our information after the end of the meeting?
Yep, you beat me to it. At the end of the meeting, I was going to say we had a good article about Heather Burns, who was a successful graduate from our drug court program. I think she was in the paper maybe on the 18th, 17th, or 18th. And then yesterday was an RSAT article where one of our lead counselors brought them a bunch of information about that. So I can attach both of those when I send out other information.
Yes, that would be very good, because that shows that we're working towards successful programs, and we need to show people that some of these programs do work and that we're not sitting still. So yeah, very good. So any other business that anybody else wants to talk about for our good of the order?
I'm going to call on Debbie to see if she wants to talk about her back to school bash. She gave me a flyer to send out post meeting.
I did want to talk about that real quick. So Umpqua Health, in partnership with Thrive Umpqua, the Douglas Education School District, Roseburg Schools, and South Umpqua Schools, we're putting on 2 back to school events. The first one's going to be August 16th from 10 to 3 at Roseburg High School. And then the second one is going to be August 21st from 3 to 7 at South Umpqua High School. And we're going to have free haircuts, tons of raffles. We're going to be hoping at least every kid leaves with some kind of school item, whether it's a backpack or a gift certificate for shoes. We've got community organizations coming in and sharing their information. We've got school clubs coming in and showcasing what the work that they're doing. Let's see, who else? Oh, we're going to have Aero Tag at the Roseburg High School. Umpqua Dairy is coming in and giving away free ice cream. We're going to do a burrito bar. And we want everybody to come in the community, and not just for, school age children. We really want to celebrate our youth and show them that, pride in our community and pride in our youth and what they're doing. And yeah, so if you could please share those flyers that Corey's going to send out to everybody, I would greatly appreciate it.
Thank you, Debbie. Appreciate that. Anything else? Oh, I know, Corey, you've got a bunch of stuff coming up to do, so go ahead and do your disposition call. Gun court graduation coming up.
Yeah, the disposition stuff I sent with our email, our numbers are still really low. I didn't have that one pulled up because we haven't been talking about that as much, but just a second. Okay, you can see my screen there. So when the sheriff's office sends me their reports for the Mary calls, I put this in a spreadsheet just so we can kind of follow along month to month. So in June, they had 20 calls, and that's dealing with people with mental health concerns. And then as far as reports taken, they had 0. And then as far as arrests, we've had 0 this whole entire year. So nobody's been arrested from any incidents that they've had to deal with these types of calls. Reports taken, they've only had 9 this whole year, and calls, they've only had 113. What I like to show is either at the end of the year or beginning of the next year, I like to kind of give a year-to-year comparison and just really show how these numbers have dropped immensely. And we always say a lot of that's due to the impact success. So with the mobile crisis program, we definitely help a lot more folks out there, so they're not having to call the Douglas County Sheriff's Office line to try and get the help through them. So they're doing the calls appropriately. They still call either 988 or the non-emergency number to get routed to mobile crisis. So the program is going strong. As I mentioned last time, grant-wise, it looks like we will still have some funding moving forward. We have not received any new information as to how much, but we have been extended to the end of this year to spend down the rest of the funds that we have for the impacts grant. So that's good news for us. And I just found out too, I think it was late yesterday or this morning, our Bureau of Justice Assistance grant that allowed us to hire the discharge planner in the jail, we did get that approved to extend a year. We got to start that program a year and a half late. It was approved right when the former LPSCC coordinator left this job. It didn't start until March of 23. Our discharge planner was hired April of 24. So you can tell from October 22 to April 24, we weren't really utilizing any of the funds. So it made sense that we were, able to ask for a 1-year extension so we can continue our good services that she's providing there. And then the other thing, we have our drug court graduation, which I sent the flyer. I can send again. It's going to be August 26th at the fairgrounds, 5:15 p.m. I heard the judge is trying to get a guest speaker. I have not heard who yet, and if he's going to keep pushing to have one.
And when you sent out the meeting notices, there was a flyer that was there. So everybody, and I think that I'll be able to go this time. I know I missed the last one because I was out of town, but I should be able to go this time. It's very worthwhile. Is there still 7 on board at the present time, Corey?
No.
Okay.
I have 6 now.
Okay.
Nothing bad. No relapse, no nothing that way. Just thinking error. And like I've mentioned before to all the groups I mentioned this to, they can't have any little missteps the last 45 days before graduating. And a thinking error or missing an appointment or something like that is cause for concern. And so they push them back to phase 4 to see if maybe that was self-sabotage or something else that they need to work on with treatment. It's different for everybody. So it was nothing bad.
Good.
Just a small thinking error. So we move forward. a lot of times they end up stronger. As Heather's article said, you know, it took her over 2 years. I mean, some people just take longer to graduate and some need more time. Some go through quick and do well, but others that go too quick have also proved maybe they should have stayed a little longer. So we're definitely paying more attention to those signals and triggers and little thinking errors, I think, especially at this stage of the game, making sure that folks are really truly ready to be out there and doing things on their own, because they're not going to have the same kind of support system that they have while in the program. We want them to build a support system that they can rely on when they're finished with the program, but that accountability with the consistent meetings with the parole officer and judge aren't going to happen anymore in treatment. They're still able to do treatment in support groups, and yes, they'll have to check in with the parole officer here and there, but it's just not the same because it's spread out and not as weekly or bi-weekly as it is when they're in the program.
Yeah, if you read the Heather Burns article, you'll see that, like Corey said, some take longer than others, but that doesn't mean just because they misstep once that they're done. They just can restart or they can move on. But they some, like you said, some take longer than others, but they're still a success at the end.
Yeah, my gal doing the wellness walk or the mental illness walk. This is her third attempt at graduating, but she's not wavered with her sobriety. She still has that same clean date of 2/2/23. So I'm proud of her with that. She's just had little kinks on along the road, but now she's doing amazing, and I look forward to her project being completed.
Very good. Okay. So does anybody else have anything you want to share? Chad, do you have something you want to share?
Yeah, thank you. Not a whole lot of updates right now from Boulder Care. We're still currently working on our reentry program. We are reformatting some flyers for incarcerated individuals participating in reentry programs. But currently at this time, we're still lots of capacity for enrollments. Excuse me. Still providing virtual map services for AUD and OUD. Basically just grounded in kindness and providing that unconditional support. So if anyone has any questions about the program or just anything like that, feel free to always reach out to me.
Thank you, Chad. And they know how to reach out to you. You have your
I'll put my email contact information in the chat just to ensure that everybody has it. Thanks for that.
Thank you. Very good. Thank you. So like I said before, other than the Heather Burns article that was in the paper, very kind of inspiring actually, because I was at her graduation. So and also the RSAT program shows how it can be also very successful as people get into it and move on into it, and there's room right now for it too. So both those programs are very worthwhile. Anything else anybody has? Okay, remember now we have no August meeting because our usual meeting is on the same day as the drug court graduation. So we're going to not have a meeting until September. And because there's what was that on the fourth Tuesday? There was something else, Corey, that we had to.
Yeah, so I did want to bring that up on the fourth Tuesday in September. The actual LPSCC Council is going to participate in a sequential intercept mapping workshop, which is called SIM mapping. And it's to talk about the different resources available, steps, different things that we have between justice system, behavioral health, crisis, law enforcement, and housing, other things. We did this back in 2018, which I wasn't here back then, but they identified 5 key factors that they felt were some big enough gaps they needed to work on. From when looking back, and I don't have that report in front of me, I apologize for that, but when looking back at that, we definitely fulfilled 4 of them. The 5th one was housing, which I know we have new apartments, we have sunshine apartments, we have new things where we've increased housing, but it's still not meeting up with, our demand for what's needed out there. So I know that's probably still going to be one of those factors that we're going to need to work on moving forward. But anybody's invited. I know this is a LPSCC thing, but I just met with Commissioner Boyce right before this meeting, and he wants anyone, everyone, news media, whoever wants to participate to see what this is about, to have a voice, to bring forth some ideas that you might have, maybe some things the council hasn't thought about. He'd love to have you there. It will be an in-person meeting at the Roseburg Public Library, and it's pretty much an all-day thing. So when I send out our notes, I'll send out the SIM flyer. It'll have a website and a QR code where you can register to attend. They do provide a lunch for folks who attend. It's basically, she said it depends on how many questions and how quick we get through things, but it could go clear up until 4 or 5 p.m. that day. And so that's why we're moving this meeting 1 week later, because that's going to take a full day. And sorry, you had a question?
I'm sorry, Corey. I didn't mean to interrupt you. I was just going to ask if you knew if there was any virtual options to join.
I can ask Maddie if there's can be one at this point. She said it was in person, but I'll ask that.
Okay, thank you.
Hey, I've only had 3 spam calls on my landline so far, so more than usual. I'm glad I'm able to mute it. So anyway, anybody else want to share anything that we haven't heard from already?
I did drop a flyer in the chat there, if you guys can see that. So this is something that we do every year. So DPHN teams up with ADAPT and HIV Alliance, and we celebrate International Overdose Awareness Day, which is always on August 31st. However, we because that fell on a Sunday over a holiday weekend, we had decided to move that to the 23rd. So please invite everybody, anybody and everybody's welcome. It's just a really good place to celebrate those, remember those we've lost, celebrate those who are in recovery, and support those who are still struggling. So please come, put it on your calendars. I want to say this because I think this is really awesome. The state of Oregon, in 2023, we had over 1,800 deaths. I think it was like 1,833. And the CDC is actually predicting that in 2024, it is actually going to go down to around the 1,400 range. So that's 400 lives less that we, didn't lose compared to the previous year. So we're really excited about that, and that's something to celebrate.
What was that date again, Kim?
So that is August 23rd.
23rd,
and
okay.
It's from 11 to 1 at Stewart Park.
Okay.
I'll include the flyer with my follow-up notes.
Hey, good. Thank you, Corey. Thank you, Kim. So our next meeting won't be till September 30th, 11:30, because it'll be on the 5th Tuesday and the 4th. Still have one in September. Remember, though, skipping August. But everybody's invited to come back September 30th at 11:30, same time, same place here. And if nobody else has anything to share, I don't see anybody's hand up, so I will adjourn the meeting. Thank you for coming.
Happy summer.
Thank you.